A very good morning to all of you present here. I extend a warm welcome on behalf of Women's Christian College to all the guest speakers and the participants who have come here. Today we have a very relevant topic that we have taken. We know the importance that artificial intelligence plays in today's world. We are trying to find solutions using this. And so this two-day conference will focus on the various aspects that AI can have on education. So as students, I think this is a very important area that you can really explore and find out what are the ways in which it can be a blessing to mankind. So for the first technical session, we have 3 speakers. And now I would like to call upon Dr. Mahalakshmi to introduce the speaker for the first session, Dr. Amrita Satyanarayanan, and this will be an online session.
Good morning, everyone, and welcome to session 1 of day 1 of the International Conference on Artificial Intelligence in Higher Education. It's our pleasure to introduce our keynote speaker, Dr. Amrita Satyanarayanan, a recipient of the prestigious Alliance Health Plus Life Science Postdoctoral Fellowship, National CDF and DST Inspire Fellowships, and a renowned postdoctoral researcher with expertise in cancer genomics and molecular oncology. Currently serving as a postdoctoral fellow at German Cancer Research Center and University Hospital, Mannheim, affiliated to University of Heidelberg. She is also volunteering as a research consultant at Tamil Nadu Skill Development Corporation for the development of AI-based cancer prediction model. Dr. Amrita's research focuses on biomarker discovery and cancer therapeutics. Dr. Amrita has made significant contribution to the field. Today, Dr. Amrita will share about the role of artificial intelligence in cancer management. Please join me in welcoming Dr. Amrita Satyanarayanan. This online session is now open, and now I invite Dr. Amrita to take the session.
Hello, everyone. I hope I'm audible. So my greetings and warm wishes to the chair of the session, the speakers, the distinguished faculty members, and the participants of the conference. It's my honor to be presenting a little bit of what I know about AI in this esteemed crowd. So without further ado, I would just like to share my presentation. Please give me a minute so that we can delve into it. I hope my screen is visible.
Yes, ma'am.
Okay. So today's topic, as mentioned, is the role of artificial intelligence in cancer management. Please give me a minute. My slides are not changing.
Can you please try to present once again, ma'am?
Okay.
Can you move to the presenter mode, ma'am?
So I hope the slide is visible now, right? So cancer can be defined as a group of diseases in which there's abnormal proliferation of cells. And as indicated in the diagram here, tumorigenesis or the development of cancer begins with an oncogenic mutations or let me say a group of mutations in the epithelial cells that make the cell more likely to grow and divide faster than the usual. So the genetically altered cells and its descendants will clonally expand and divide in an uncontrolled manner and reach a stage called as the hyperplasia stage, which is mentioned here. And the next stage is dysplasia, where the cells lose their origin and they'll have more increased growth potential, and the mutated cells also will be in a larger number compared to the mature normal population. So the next stage comes the in situ cancer stage, where the cells will rapidly grow, but they will be localized in one place and they would have lost their tissue identity. So this is a malignant stage, but it will be very, very localized. The next is the invasive stage, in which the cells will invade to the neighboring areas and into the lymphatic and the blood circulation systems, where the basal membrane or any organ member is breached. So the final stage will be the metastatic stage, in which the cancer cells will reach to distant parts through the lymphatic and blood circulation and invade the other organs. So this is the basis of the development of cancer in most solid tumors. And what and how is cancer caused? So this is a question that people are still finding answer to till date. And the number of carcinogens and the factors that are causing cancer are increasing day by day. We will see the most common ones. If you see, cancer is caused by a mixture of genetic and non-genetic factors, and these factors differ according to the type of cancer. So there are genetic and non-genetic factors, and in the genetic factors, there are inherited mutations which will be carried from your family members. And for example, the BRCA mutation in breast cancer. And the second one can also be like the non-modifiable or genetic factors can also be ethical and racial variations. That is, each population will have a specific genetic pattern. For example, the African Americans are more prone to prostate cancer than any other population. Similarly, the Asians are more prone to colorectal cancer. So these are factors that cannot be modified. But to the astonishment, only 5 to 15% of cancers are caused by genetic factors. The rest of the 80 to 90% of cancers which are caused are due to lifestyle or the modifiable factors that is indicated here. So this is a data that is being put together by the American Association of Cancer Research. And this says that in the form of increasing cancer risk, smoking, obesity, alcohol, exposure to radiation, poor diet or gut health, then virus-prone infections or any sustained infections, and lack of physical activity are the top most risk factors which cause cancer. Apart from this, there are also exposure to environmental pollutants, then chronic inflammation due to poor gut health or other factors, then poor metabolism and stress, which can also cause sustained inflammation, and then exposure to chemical pollutants through cosmetics or any other external sources that you wear. So these factors are modifiable, and altering this would actually prevent half of the subtype of cancers that are caused. So, but the glitch here is the risk factors will vary from population to population, and there are also a lot of other factors like lifestyle, physical activity, the area that you live, the kind of water that you drink. Everything will influence your cancer-causing genes or mutations in your genes. So how does one access or assess the cancer risk and know which set of risk factors are going to be is an individual exposed to, and is that really going to cause a cancer in 5 or 7 years? So that's where artificial intelligence comes into play. So AI basically refers to the use of computational systems and algorithms to analyze complex medical data, assist in decision making, and improve patient outcomes. So the different steps in cancer management, if you see, are basically prevention, early detection. Prevention is what what I told earlier about risk factors. Then comes early detection, which is basically performing or getting yourself checked through regular mammograms or colonoscopies regarding our pap smear tests, regarding any abnormalities in your organs or parameters. And the third step is diagnosis, which involves clinical evaluation. If you have any symptoms, a clinical evaluation of it, followed by some tests, imaging tests, for example, mammograms, biopsies, or ultrasounds to confirm the presence of cancer. That is diagnosis. And it will also determine its primary location and the stage. Next is the prognosis, where depending on the subtype, pathological subtype of cancer you have, what are the response rates for that particular subtype? Will this treatment work or not? Or what kind of treatment should a clinician cater to you? So prognosis is going to tell us all of that. And then treatment obviously encompasses the various therapies, for example, surgery, radiation, followed by chemotherapy. And this would aim at reducing or completely abolishing the cancer or the tumor. Next comes the surveillance, which again involves monitoring whether the patient is responding during the treatment and also after the treatment. That is a follow-up in which we check whether the patient is completely cancer-free or if there is any signs of recurrence. So that is surveillance. And finally, in patients where the disease is not completely abolished, but controlled in a manner, we keep checking the follow-up data to see if there are any distant metastases, because even in patients who respond temporarily to therapy, in 3 to 5 years, there will be some recurrence in the other distant sites. So that also needs to be checked. So as you've seen, there's a myriad of steps in cancer management, and each step requires a set of specialized professionals to ensure that each step is carried out in a very accurate manner with the wellness of the patient in mind. It can be quite exhaustive, considering the number of people who nowadays have got alarm of cancer risk. So artificial intelligence, employing the machine learning, deep learning, or natural language processing mediums can be applied to basically integrate all these steps, and so that there will be better treatment planning, prognosis prediction, and personalized care. So by processing these large volumes of clinical data, genetic profiles, clinical histories, everything, one can predict the disease and the treatment strategies in a faster manner. So what are the bases of artificial intelligence? So I would not be delving too deep into it, but I will just talk only about machine learning and deep learning. So because that is the maximum platforms that are used in cancer management. So machine learning, if you see, to put it in a simple way, is a way of the computers to learn, basically to educate the computers regarding patterns of benign, malignant, or different kind of cancer patterns based on the morphological, pathological, cellular, and molecular patterns that are derived from the patient data. And based on this, to educate it to make decisions without being explicitly programmed. So machine learning is more a superficial platform, but it still integrates all the data that I would give, and it would give a prediction feature. Deep learning is more an advanced type of machine learning. It's a subset of machine learning that will use artificial and neuronal networks. So that is, the name is influenced from the neurons of the brain, human brain. And it is educated to analyze complex patterns and deeper patterns. So it is like, for example, giving a kid a superpower to recognize not only animals, but the kind of breed, where the animal could have originated from, or what is the animal's behavior. So all these are details, more details. So that is the difference between machine learning and deep learning. So both of these platforms are used to feed patient data from each of the steps of cancer management that I told, to develop models that will help and make cancer management easy. So I wanted to focus on two cancers today, which is the breast and the ovarian cancer, because I felt that it would be more relevant because majority of the participants here would be women. And so I thought, since yesterday was World Cancer Day, and women's health is something that we constantly strive to improve, so I felt that this would be better. So breast cancer, as we know, is the most common female malignancy. The disease basically originates from abnormal proliferation of epithelial cells from milk ducts, or in rare cases, sarcomas come from connective tissues or the lobules. So the primary diagnostic module of breast cancer is taking a clinical evaluation followed by a mammogram. So, and if they find anything abnormal in a mammogram, which means, so the radiologists ideally classify the mammogram findings into a system called as the BI-RADS, which is nothing but the breast imaging reporting and data system. So as you can see in the table which I have given here, till the BI-RADS 0 to 2, the findings are not that alarming because it's classified as negative or benign. But from the BI-RADS 3, which says that the nature of the lesion or the nodule that is seen might be malignant or benign, and the type 4 also is suspicious, requires a tissue diagnosis, which means that a part of the tissue is plucked from the tumor region and it is sent to a pathologist to examine whether there are abnormal epithelial cells present or not. This can be only performed by expert surgeon and pathologists. And it can be quite painful, this procedure, the biopsy procedure. And next comes the 5 and 6, which is highly suggestive of malignancy. Now, the regions, I mean, the patients who have staging of BI-RADS 3 and sometimes in BI-RADS 4, even in BI-RADS 3, sometimes surgeons or the clinicians suggest for them to go to biopsy if it looks suspicious. And there's a lot of alarm and anxiety in patients because, one, it is painful, and also the stress accompanied by the results of the test. So in gray areas or gray systems like the BI-RADS 3 and 4, the interference of artificial intelligence is something that is very miraculous. There is one model which was developed by the MIT researchers from the Massachusetts General Hospital, and they developed a deep learning model called as Mirai that predicts breast cancer risk from mammograms up to 5 years in advance. So if you see, there is a image that I have displayed, which I have taken from their report. Here is a very, very small abnormality or a structural abnormality located, which normally a radiologist or any sort of clinician would probably not assume that it might be a suspicious malignancy, which is also not something that is alarming. But this particular model has predicted that this small alteration or a figure that is found can develop into a probably malignant lesion in 5 years. And with the follow-up data of the woman, they found out that it had indeed developed into a malignant lesion within 5 years. So that is the predictive accuracy of AI here. And this model was trained with around, more than 1 lakh mammograms, which retrospective mammograms, which means there are data which had previously taken from patients, and from around more than 60,000 patients, to educate the AI model to the different patterns of the tissue architecture indicative of future cancer development. So the prediction accuracy of this was 31% in cancer patient with the highest risk category, as compared to conventional or traditional methods, which have only 18% accuracy. So the advantage of it, like I said, is detecting subtle patterns. And the other models also, I have put up some of it here, which are like the hallmark papers. I'm not going to go into detail with the virtue of time, But so there was one study performed by the radiologists in Sweden, which again had a model which could develop cancers 20% better accuracy than the previous traditional methods. Again, there was another model that was developed in Germany, which did better than the traditional methods. And there was one particular AI tool called iBrisk, which also reduced, like I said, the unnecessary biopsies, which is required if there is a suspicious lesion, which is not basically able to classify whether it's a benign or a malignant at the radiological imaging messages. So these tools helped improve this. And in one more model, our tool was also able to predict whether the patient who's come requires an additional MRI or not. So there are patients who come into the intermediate risk category. That is, these are patients who have family history of cancer, where their mother or aunt or grandmother has history of breast or ovarian cancer, but they have not detected any genetic mutations in that particular person yet. But still, there is a chance that the person might fall into an intermediate risk category. And sometimes MRI is available to them. For some patients, it's not available due to logistics. So which patients need the assisted MRI and which patients don't, that the AI model is able to predict. Next comes the LINA. It is again a deep learning model, and it is the abbreviation expands to lymph node assisted model. Basically, that is LINA. And usually there is something called as a sentinel lymph node biopsy, which is performed for breast cancer patients. That is to evaluate this, the extent of spread in lymph nodes. Based on the position and number of lymph nodes that are positive for cancer cells, they decide on the pathological staging and the further course of treatment. So this particular model was developed by AI, Google AI, and to detect cancer cells in the lymph nodes, like I mentioned. And it was a great assistant to pathologists. And based on the data that is available, we could say that the model identified tumor metastasis in the lymph node regions with 99% accuracy. So to just prove it, this is basically the IHC image, H&E stained image, and this is the deep learning model prediction. The red color regions that you see are the regions of cancer cells or the metastasis in the lymph node. So this is how it shows, and the prediction is done and a predictive score is given. This is a great assist because this is a very, very important step before the cancer treatment has begun. Next, we'll go to the other female malignancy, which has got the maximum number of lethal cases, or mortality rate is quite high in this female malignancy. And because one, it is very heterogeneous, even though 80% of population respond to the initial therapy, more than 60% of patients will have recurrence within 5 years when they are detected with the high-grade serous epithelial ovarian cancer. So a pap smear test is usually done for monitoring. Along with it, there is also a pelvic exam and a CA-125 test done to see whether it is elevated. It might be indicated of malignancy. So the 5-year rate, survival rate of this woman, people who are diagnosed before the stage 3 is 80 to 90%. So here also early detection is a key for better response rates. This is where AI can help us diagnose this particular cancer, which is quite difficult to detect in earlier stage. So the researchers have basically designed a deep learning model called as the OFCA Finder. OFCA is, the specialty of this model is it is a multimodal AI model. That is, it does not integrate only in imaging data, radiological imaging data, but it also integrates other clinical features, pathological data, and blood parameters. So it is a interpretable model which integrates multitude of factors. And So, and it's also based on the ORAD system, like the BIRATS. There's also a classification system called as the ORAD system, that is the radiological imaging from the clinicians. That also is basically integrated into it. And this can be trained to identify also whether the particular abnormality that you see is benign or malignant. So in this case, if you see, these first two rows are from patients, the data from patients in which the radiological imaging couldn't predict properly whether it was a benign or a malignant, or there was some misreading in the diagnosis. And this third is, if you see, this is the AI prediction, and the minute red dots or red shaded areas you see is the probability of malignancy. So despite the traditional methods misreading the particular image, AI was able to correctly predict it. And this model also yielded up to 97% accuracy. Now, the next stage, like I said, was because now ovarian cancer is very heterogeneous and it's got multitude of subtypes. So AI can also be trained to identify which subtype of ovarian cancer does an individual possess. And as we can see, there's a data which is present here in which it's clearly shown that AI models have better prediction capabilities when compared to experts and non-experts. In here, experts mean the oncologists or the specialists, and the non-experts are general physicians. So this model was again developed with more than 17,000 ultrasound images. Other applications of AI in ovarian cancer and tackling ovarian cancer glitches is one, it can also be used as a prognostic model. For example, there was one model called Beyond Cell, which was basically trained from the expression patterns of around 20,000 cells from ovarian cancer samples, and also signatures of more than 5,000 drugs to identify drug-resistant cells. So based on the subtypes, AI can predict prognosis. It can also predict drug responses, because each subtype will respond to a drug in a different way. So some will respond poorly, some will be very aggressive in nature, whereas some will respond very well. So AI can predict this. Next is the second study will indicates basically a AI model which can predict the clinical outcomes, whether a patient is going to have a complete response, a partial response, or no response at all. In this case, they have tested that for estrogen receptor and progesterone receptor therapy, which is given for ovarian cancer patients, whether a particular patient how much would the patient respond, and whether the patient will also face a recurrence or the disease will come back in a short interval, or in how much interval the disease might come back. That also the AI model has predicted in this case. So these are the basic applications of AI and the seminal papers which were published in course of the breast and ovarian cancer. I would like to briefly mention what I do. My current research right now is on cancer, and I'm a part of a clinical trial in which we test a combination therapy where we use DNA damage response inhibitors and immune checkpoint inhibitors therapy, combination therapy for newly diagnosed high-grade serous ovarian cancer patients. And once we receive the biopsy samples pre-treatment and post-treatment, we do something called as a single cell RNA sequencing, in which the resolution of the gene expression patterns is measured from each cell. And then we also are doing a platform called as spatial transcriptomics, which would basically give us the temporospatial location of the cells and the tissue architecture of the particular tumor microenvironment. This is basically done to see whether what is the interaction between our tumor cells and the immune cells, and whether this therapy is affecting the immune cells or not, or what are the changes that happens in the tumor microenvironment. And based on the data that we are going to receive, we are expecting to classify the tumors according to the immune phenotype that they possess. And we are planning to build an AI model, which will, again, once all the data is fed, when a patient comes, based on the immune subtype the patient has, the AI will be able to predict whether this particular combination therapy or immunotherapy or any targeted therapy that we are using is going to benefit the patient or not. That is basically our research now. So earlier for the inaugural session, there was a mention of ethical considerations when integrating AI. So I would like to talk about it in clinical settings in a very brief manner. So confidentiality and consent is something that is of concern because there is myriad of data that has been fed for deep learning, but it is also important to obtain ethical, informed consent from patient, but it's very difficult to basically get individual consent from each person. And then there is also bias and transferability, in which there are certain set of data which is basically fed, and it will only probably represent populations that are high, like a Caucasian population or Afro-American population in which the study is done. There are also populations which are minor and less in number, or populations which have not been explored. Now, the deep learning model or the machine learning model won't have data regarding those populations, and it cannot basically predict the variability or basically predict the structural differences that can be extrapolated to that populations also. So there is bias in data. And there's also transparency and explainability. Often clinicians have also told that AI can be called as a black box because in some cases, they're not able to predict the basis of the decision that the AI has delivered in a patient. What are the reasons that is arrived? And there is not enough backup data to prove whether AI is genuinely accurate or not. And another thing is influencing the mindset of people. A lot of people are now dependent on AI-based decisions, and they don't really believe the doctor or the clinician when he suggests a treatment or he suggests an extra test. So this can also compromise the doctor-patient relationship, which will definitely influence the outcome of the patient to a particular therapy. So, like, a lot of questions arise whether AI can replace human beings, clinicians, researchers, or technical experts. So from my opinion, I would say not yet, because, it is a great platform, but right now it's just a very accurate, fast, but only a second pair of eyes. Definitely a human intervention is needed, especially AI will predict most common cases or the most common type of subtypes which are fed in the data sets, and it won't have a lot of information on the rare or complicated conditions, especially on aged patients who will have accompanying diseases like diabetes, hypertension. All these comorbidities would also influence a patient's response to a particular therapy and everything. So human intervention is definitely required for this. And also more clinical trials and validation are required to make the AI systems more safe and reliable. So to a radiologist. Yeah. So that's my content for today. I'm open to questions. Thank you so much for your patience.
Can you hear me? Hello? Hello?
Ma'am, are you able to hear?
Yeah, I'm able to hear.
So thank you, doctor. I think it was really a very nice session. Though I think it's a very technical field, you explained it in such a simple manner, we were able to understand. I hope the students also agree with me. Especially being women, getting an awareness about this, I think is definitely very crucial. And you explained it so explicitly, and we were able to really understand it step by step. I open the floor for discussion. If there are any questions that you would like to ask, I would like to hand over the mic to you.
It was a wonderful talk, Dr. Amrita, and very advanced type of diagnostic research which you have been carrying out in the field of breast cancer and ovarian. This thing is really commendable. I just have one question. Currently, as a gold standard for cervical cancer, we do liquid biopsy procedure, which is far more advanced than the conventional pathological biopsy. Is there any tool which predicts the response of course of treatment among the patient who are with the cervical cancer based on the data of liquid biopsy?
Yes, ma'am. Yes, ma'am. Yes, ma'am. Yes, ma'am. She joined again.
Hello, can you hear me?
Yes, ma'am. Yes, ma'am.
Yes, sorry, the connection got disrupted.
Yeah, I just wanted to repeat my question, Dr. Amrita.
Okay.
For the cervical cancer, the advanced diagnostics which we do right now in India is the liquid biopsy studies, right? So which can detect the prognosis or the outcome of the treatment, whether the patient is going on right now. Just wanted to know if there is any AI-driven analysis or any type of tool which has been developed integrating the data of liquid path with the conventional path as well as which can predict CIN scores.
Yes, there have been basically I read a paper in which there is an artificial intelligence model which can integrate the HPV infections subtype along with the pathological features and also the age of the patient into consideration. So these are some factors which they had used to train the AI model. I didn't focus on cervical cancer today because I felt that in the given time, breast and ovarian cancer would take up a lot of the content. So I could pass on the data to you later. But yeah, to answer your question, there is an AI model to predict the HPV subtypes and the infection along with the pathological features.
Thank you, Muni. That was a wonderful talk and so much of information regarding the advanced work which you have been
Can I
doing
ask?
over there.
Am I audible?
Yes.
Yes, ma'am.
Yes, I can hear you. Please go ahead.
And you can ask your
Hello?
question.
Yeah, I
Yes,
can.
ma'am.
I
Your
can.
Yeah, okay. I'm Dr. Kailari. It was such a wonderful presentation. Can I continue or text message?
No, I can hear you. Please go ahead with the question.
Am I audible, ma'am? Because data connection, internet connection is lit.
Yes,
Yeah,
yes, you are.
yeah,
You
it
are.
is a
You are
wonderful
audible.
session, ma'am. One thing is, what about the cost effective and in India? Yeah, what about the cost effective to use this technology to detect cost effective as well as right now in India, how many of them is it trained personnel are there to keep pace with the patient's number?
Yes, so obviously India is a bit behind in integrating AI into clinical management because of the number of patients that we get. And another one is where there is requirement, the pace is faster. I can talk about Europe. In Europe and in UK, lot of people are short-staffed. There is a lot of demand for pathologists and trained radiologists to be on the panel to diagnose the cancers that are coming up. But because they are short-staffed, they have integrated AI into their diagnostic and everyday clinical practice to speed up the process. But in India, because of the population, we have a lot of people, staffs, who to do the basically the functions that an AI can do. So there is also an alarm between people if AI can take up their employment opportunities. That is why there is reluctance in accepting AI into the clinical management or in everyday practices. But we are catching up. There are, like I mentioned, there is a separate team who are working on integrating AI in various aspects, be it bioprocessing, engineering, developing spare parts and everything in the Tamil Nadu Skill Development Department. And I got to know very recently about this, and I had a brief interaction with them. I am sure that the government is going to take more initiatives for developing skills, for developing skilled people who will be able to make some more, contributions of developing AI models to suit the applicability of the audience or in various sectors. And regarding the cost, yes, it is not cost effective as of now, because I mean, in US or be it the European economy, they have a lot of funding for research and they are not short of funds. So sustainability is not really a factor for them. But I'm sure in India, we will find some alternative sustainability measures, because that's what we always do. We find fixtures in which we could make generic drugs, make models which are sustainable to our economic population or to our working population. So that's what I hope that it will happen. From what I've seen, I think there's also a talk in AI in sustainable health management. So I think that speaker would be able to tell us more about it.
Thanks a lot, ma'am, for your detailed explanation. I'm not a doctor or clinical. I'm a teaching professional. I'm working in Pondicherry as a assistant professor in Department of Clinical Nutrition, and that is we have BSc Nutrition and MSc Food Service Management. So not only in this medical, even we the teachers, we have to equip to keep pace with what is happening. Slowly we have to equip. And I understand what is happening in India, what is in other countries, developed countries. Thank you so much for all your inputs and insights into AI that helps us where we are standing and how much we have to come up to learn and equip ourselves. Thank you, madam.
Thank you.
In our own area.
Yeah.
Thank you, ma'am. Is there any other question? Regarding ma'am, and that was a wonderful presentation. And so I'm not from an exactly biological background, but I came across some studies where, cancer cells mimic as viral and bacterial infection is what I've read. So will these AI models be able to differentiate between what is cancerous cells and the cells which mimic as cancerous cells? And also another doubt is that there is some precancerous lesions which are seen, which is not as invasive as these cancerous cells. So will the AI model be able to detect which is invasive and which is not? Because if the AI model detects every cell as invasive, we have to go through the painful biopsy treatments to detect the indication of cancer. So that's my
Yes, so to answer your first question, yes, there are some infections which mimic uh, cancer, or rather have a lot of symptoms or pathways that get activated in the body that are also activated when a person has cancer. There are a lot of inflammatory pathways and a lot of DNA damage response pathways that are very common to some sustained viral infections and cancer. But there are some cellular markers, or what we call as circulating proteins or cytokines, which are exclusive to cancer and which are not particularly elevated in viral infections. So when we integrate our research data, clinical data, and whatever blood parameters data or cellular data into a multimodal model, and we feed it into a AI development tool, I think it would be able to tell whether, to an extent, whether the patient is got an sustained inflammation or a chronic inflammation due to a viral infection, or is it because of cancer. And this is basically comes very handy in liquid malignancies where there is no tumor seen, but there are a lot of abnormal blood parameters, like a patient will have sustained fever, and nobody will initially think that it's leukemia, but because they will rule out other infections which are caused by pathogens, but then in some cases it will turn out to be some sort of leukemia. So in this kind of cases, integrating AI will be very useful. In solid tumors, anyway, you will have a lesion that will be visible with your radiological imaging platforms, so that should not be a problem. Answering your second question, whether AI can help predict the transformation when the cell is in the pre-malignant stage. Yes, it can. I myself have done a study during my PhD in which I got a set of parameters by wet lab testing. That is, those are methylation genes. Methylation is one sort of chemical modification that happens on your genes, and it differs according to person, and the genetic pattern in which the modification happens is different from a normal individual and different for a cancer individual, and this particular chemical modification happens in the pre-malignant stage itself. So there are a lot of, like my research, there are a lot of researchers who have identified these epigenetic patterns, and they have published data, and these data sets are available on CBio portal, like user-defined cancer data set platforms like CBio portal and MBell and all of that. And once they integrate these data sets into a tool, it will be able to predict whether a particular cell which is in a pre-malignant stage or a benign stage, whether it is going to get transformed into a malignant one or not.
Thank you, Doctor. I think we will wrap up this session. Thank you for patiently answering all the questions, and thank you for, I think, assuring us that though AI will assist you in medical intervention, it cannot replace human intervention. So thank you so much for that. And I once again would like to thank you from WCC for taking your time off and giving us a very valuable session. Thank you.
Thank you for having me. And I would also like to thank all the participants and the organizers for inviting me for this. And I would be gladly of help if any of the students want to reach out to me through LinkedIn for any career guidance or any questions that they have regarding science. Thank you so much.
Thank you, ma'am. I hope students will made a note of what ma'am just told you. Thank you.
Thank you.
Next section.
We will begin our next session. I now invite Dr. Sherlin to introduce Professor N. Rajendran for the next session. Welcome, sir. Yes. Good morning, everyone. I deem it a pleasure to introduce the resource person and speaker of our second session, Professor Rajendran Sir, former Vice Chancellor, Alagappa University, Karaikudi. Sir has 35 years of teaching and research experience in the area of history in Pachepas College and Bharathidasan University. Professor Rajendran has provided able leadership and efficient administration as the Vice Chancellor of Alagappa University, Karaikudi. With his academic credibility and leadership quality, Professor Rajendran has created benchmarks in higher education by achieving national and international ranking. Sir has numerous achievements to his credit. He has visited many academic institutions abroad in China, Singapore, Malaysia, and Sri Lanka. He has been the founder director of Bharathidasan School of Management and Center for Social Exclusion and Inclusive Studies at Bharathidasan University. He has also served as the director of Center for Distance Education, Dean, Faculty of Arts, and coordinator for RUSA scheme in the same university. He has been honored with prestigious membership in the Indian Council of Historical Research, and he was one among 18 historians all over India. Sir has been a member of the UGC Review Committee for Center for Advanced Studies of University of Calcutta and Jawaharlal Nehru University. Sir has served as the General Secretary of the Tamil Nadu History Congress for 10 years and also the General Secretary of the South Indian History Congress, and he is the only academician to hold this prestigious position of General Secretary of two premier history associations simultaneously. He has produced 20 PhDs, guided more than 102 scholars, and published 65 articles in various national and international peer-reviewed journals. He has also contributed academic articles in the Hindu, Indian Express, and Frontline. As an eminent historian and a prolific writer, Professor Rajendran has published and edited 12 books, and special mention to his research book on national movement in Tamil Nadu, agitational politics and state coercion, which is a unique research book and a magnum opus of all his writings, in which he has challenged the thesis and ideas of the Cambridge historians. He has been honored with a citation of meritorious achievement by Cambridge University. Besides, Sir has received the Best Tamil Book Award and honored with the title Sindhani Perodi for his book Tamil Nadu Desiyam and Swadesiyam in 2003. Sir has delivered 170 lectures as resource person and invited speaker for academic programs, including UGC refresher and orientation courses, training programs, and endowment lectures. He has presented 162 research papers in various national and international seminars, workshops, symposiums, and conferences. Sir has also organized 10 UGC refresher courses and more than 65 national and international level conferences and seminars sponsored by UGC, ICHR, and Tanshen. As a member of the research board, Sir has been instrumental in shaping the curriculum of a number of universities like Bharathidasan University, Periyar University, Tiruvallur University, and Tamil Nadu Open University.
Sir has served as a member in the Board of Studies in various colleges and universities across India. The honorary colonel rank was conferred when he was Vice Chancellor in recognition of his service in the field of academics, research and higher education, and for promoting NCC in the affiliated colleges. Sir was the only VC to be conferred this rank in 2018 in Tamil Nadu. Sir has been a visiting member, has been visiting number of institutions as chairman of the NAC Pure Team for NAC assessment and accreditation. With his academic credibility and leadership qualities that has provided clean and transparent administration in every position he has occupied so far, which has been highly appreciated by the academia. We welcome you, sir. Now it's my pleasure to hand over the floor to you.
Good afternoon to everyone. Respected principal, faculty members, the organizing committee, and distinguished resource persons, and my good friend, Professor Nageswara Rao is here, and dear students. And in fact, when I was being introduced, I think a word of caution has also been introduced to say that I am not an expert in AI. Basically, I am a historian and also an academician, an academic administrator. But AI, in fact, has made an inroad into everybody's life. That is the most important. And it is continuing to do so in the years to come. So the moot point is that how we are going to face the growth of AI, the years to come, and then how we are going to have regulatory mechanisms, particularly in the field of education. Because when we say education, and the education is not a few enclaves of schools of excellence or institutions of excellence, like IITs or premier institutions in the metropolis. It is not so, because India, if you take the demography of India, as well as the situation of institutions in India, when we got independence in 1947, we can count 20 universities across India for 34 people. 20 universities and 500 colleges, mind you, for 30 crore people. And today, what we have is more than 1,000 universities and 40,000 or 50,000 colleges across India. That is the growth curve. But most important thing is the GER. GER, the gross enrollment ratio, is closely associated with the development of any country for them. So those developed countries have GER more than 50%. But if you take a country like India, for example, in 2005, our GER was only 11%. 2005, our GER was 11%. And very recently, we have an ambition to achieve 50% of GER, but the current rate of GER is 28%. So there is a correlation between the GER and also the development of it. And most important thing is the diffusion of technology and dissemination of technology. Because if you take the length and breadth of India, you may not imagine. Of course, I had an opportunity to travel length and breadth of India to remote parts of India, institutions. In one institution, when I went there, and they said, when do you start your college? They said the students come here by 11 o'clock. I'm not making any secrecy of this. 11 o'clock. Why 11 o'clock? Because at many places, people go to colleges, students, even children go to schools about 7:30 or 8 o'clock. No, sir, these students work in the field. They work in the field. And then after finishing the job, they come to the college. Why I am telling you this is, we must situate AI only in this scenario. Most important. We cannot situate AI in the scenario of what we know. So this is the most important aspect of understanding AI. And moreover, most of the technology diffusion refuse to take place. That is also very important. Because how many of us are conversant and very effectively we are using our PPTs in the classroom, for example. Because I am asking this as an academic administrator, we want these PPTs to be, because it is a NAAC criterion. One of the NAAC criterion is that you must use ICT in the classroom very effectively. But do we have ICT, say, embedded in our timetable? You can look across any of the developed or say premier institutions. No, it's fits and starts. Some of the faculty who are really proficient and who would like, particularly sciences, they may be using PPT. But it is not being used systematically. This is the most important. And how many of us are using internet? When internet being introduced in India, in fact, the easiest form of research is what they say in Tamil, nettu, vettu, ottu. So which means you browse, cut and paste. So your assignments are ready. So we use technology only for a short purpose. It is not for innovative purpose. It's not for developing ourselves. But in fact, internet can do wonderful things. It can assist our research. It can do things that we fail to do during our days. But you are endowed with such technology. Whether this diffusion of technology is taking place in the country, because in India, what we find is the education has moved alongside industry. Today, we say industry 4.0 and 5.0. Similarly, education also moved from 1.0 to 5.0. It was Dr. Bhushan Patwardhan, formerly the vice chairman of UGC, who has authored an article in EPW, where he traced the contours of education in India. He says the 1.0 is a traditional form of imparting knowledge, where it is teacher oriented and teacher is an authoritarian in the classroom. Do you think it has changed? Do you think it has changed? And the second 2.0 is exam oriented, where memorization of knowledge and in fact knowledge is state not as a creative mechanism, but only from memory. And I'm also asking the same question whether it has changed right at this moment. And the 3.0 education is where the teacher becomes a facilitator and a guide to assist innovation, to help these students to understand. It is student-centric. And also, flipped classroom is beginning to take place. Because when I say flipped classroom, I had an opportunity to visit NTU, Nanyang Technology University. When we entered, we wanted to see a model classroom. We entered the classroom. In fact, the classroom was not the type that we have in our traditional pattern. Why I say this is, we have rows of benches and of course seats attached to it. And we see from a horizontal, say rectangular position the teacher. But there, it is like a dining table. Each, there are several 15 to 20 round tables. And all these round tables have provision for laptop with Wi-Fi connectivity and also 3 screens like this. So the moment the teacher enters the class and start lecturing, and immediately when he say he's going to take AI and its say uses and misuses, immediately there is a question flashing on the screen. The question is prompted by a student who wanted to ask. So the teacher cannot dictate. He cannot move, or she cannot move from A to Z, what already prepared, because students have already read about it and at home. And here when they come to the classroom, it is skill development. So they test their knowledge and develop their skills, where it is very difficult for the teacher to handle the class, because teacher never know what exactly is the student is going to ask. Way back in 1982-83, I was working in one of the colleges here in the city. My first class, of course, I said European history. There is a portion called Eastern question. Eastern question is a very difficult and complicated one. So normally teachers avoid. But I went to the classroom with a map, made my preparation well, and then I began my lecture by saying, it is called Eastern question because on the eastern side of the Europe, we have a problem. So it is called Eastern question. And it is also called Balkan problem. This is what is there in the book, which I repeated. Immediately after some time, a student got up and asked, sir, you said, why it is called Eastern question? Because you have a problem on the eastern side of Europe. And you also said it is called Balkan problem. What is Balkans? Then I was actually scratching my head. This question never occurred to me. This question never occurred to me. Because what is there in the book is sacrosanct for us. It is sacred. We repeat it in the classroom. But a student is asking a very logical question. Very logical question of what is there, what we have stated. So normally, of course, Balkan means a Turkish language, mountain range. It moves from east to west. That is the reason why it is called Balkan Peninsula, which I came to know next day because I simply said it's a good question. Whenever a teacher is faced with a question you are not able to answer, you simply say it's a good question. So the ego of the student is also to some extent subdued, and you duck the question. I said that tomorrow we'll answer. I'll answer because it's too late. I have to complete the portion. But this is again a problem of we are in our comfort zones of understanding the technology and also using the technology. But today, what I'm going to share with you is, so whatever I say, it's not moving. Please move. Can you operate from there? Because what I'm going to share with you is certain slides of one important aspect is there are three men to consider who sought tomorrow. The men who sought tomorrow. The first one being Alvin Toffler. Alvin Toffler in the 1970s wrote a best-selling book called Future Shock. And here he traced the growth of human civilization up till the modern times, where he said it took nearly 1,400 years to move from an agricultural-based community, society, to industrial, what we call industrial revolution. And these are already I have given you insights. So I'm not going into it. This is also I have just told you. This is where we are. So Alvin Toffler, when he wrote this book, he cautioned one thing: the rate of change is very phenomenal. I said 1,500 years it took to move from an agricultural community to a society to industrial society. And it took 300 years to move from industrial society to information society. In 50 years after 1945, what we find is several transformations are taking place within the information. So he said it is very difficult to cope up with the rate of change because the older generation who are entrenched in their own habits, they gradually change. So not all minds. If you ask the younger generation today, they are very conversant with the social media as well as with the, say, mobile. As this morning, the honorable speaker was saying that they are now addicted to mobile. It is true also. But at the same time, for an older generation, though they also use it, but they may not be able to use it as the likes of the younger generation. And that was a caution. And similarly, Megatrends, Naismith, in 1980s, he wrote this best-selling book. And there he gave 10 trends. And he said the industrial society will be replaced by information society. And also there will be phenomenal changes in the sphere of finances, from national finances to global finances. And also individualism will grow. Most importantly, he predicted in the 1980s work from home. Why I say this is, I did not join Bharathidasan University as a lecturer in history department. I joined the Department of Futurology. So now those departments have disappeared, but yet there we have an opportunity to learn the anticipatory management and what are the changes that are taking place in society. And there these mega trends, what he said in the 1980s, we never anticipated. Today, most of the software engineers have hybrid mode or they sit at home and do their work. It's become a reality. And Blade Runner, Ridley Scott's movie, again, this was released in 1984. And I had an opportunity to see this movie in 1980s in the Casino Theatre. Along with me, there was a professor, a senior professor, who happens to be a Shakespearean actor. And after seeing the movie, when we were traveling by an auto to home, he said, "What picture is this that I'm not able to make out?" 1984, Ridley Scott's, a classic, in fact. He said, "What is this movie? There is no head or tail, I can make it out." Because it was talking about replicants. It was talking about what we call today in the common parlance, robots and sentience with feelings. And there are certain philosophical questions. I have a clipping from this. Can you play this? How do you play this? There is a no, you have to play this. Yeah. There is a play. And the video. Is now you can understand very difficult to master the technology. And very mundane technology that also. It is not very complicated. Because I could see that in my own laptop, but when it is being transferred, and there must be a play button somewhere. All right. We move on to the. All right. You're not able to play.
It's the image.
No, it's well, conversion it has come like.
Yes.
All right. go to the, that's what I'm saying. In my desktop, I did the PPT. And because there are certain visuals where Harrison Ford is the hero there. And he is called as the Descartes. His name is, and he was instructed to remove certain, say, rebel replicants or rogue replicants. 6 of them were identified. He was given a mission to remove them. And he visits the Tyrell, Mr. Tyrell, who runs the corporation of producing the replicants. When he enters his office, there is an owl which flies and then sits on a pole. And there is a Rachel who comes there. And she is a replicant, by the way. Rachel is a replicant. And she asks a question, you like the owl? And immediately Descartes says, is it artificial? Yes. Then he says it must be very costly. Most important thing is, throughout the film, Descartes hunts these 6 rogue replicants. But ultimately, the major question remains whether Descartes himself is a human being. That is the question. So if you are able to view this film, you have to pay rent and view the film in time. Kindly view the film. It raised the questions in 1980s about certain phenomenal things like whether the robots have or replicants have feelings for them, for the other human beings. Whether these feelings, how the corporation can subvert, how they can eliminate, all these things are very moral and ethical questions. And that is what we are going to see here. The film explores profound essential questions about what it means to be human, the nature of reality and the value of life. The replicants' quest for meaning and their struggle with mortality raise questions about the essence of humanity and the purpose of existence. And here, the heart of Blade Runner lies profound exploration of moral implications surrounding artificial intelligence and genetic engineering. The creation of replicants raises ethical questions about the responsibilities of their creators, the Tyrell Corporation, the entity responsible for the replicants' existence, embodies the unchecked ambition of humanity in its quest for innovation. In its relentless pursuit of progress, the corporation fails to recognize the moral obligation it holds towards its creation. The same thing in the first one. The replicants' desire for life and their quest for autonomy emphasize a critical dilemma regarding the ethics of creating sentient beings. If these artificial entities can experience, that is the most important question, experience emotions and form connections, does this not confer upon them a certain degree of rights? The film invites viewers to grapple with the consequences of playing God, urging us to consider the moral ramifications of our technological advancements and the potential consequences of exploiting sentient beings for personal gain. This is going to be our future. And what is AI? Artificial intelligence refers to simulation of human intelligence in machines that are programmed to think like humans and mimic their actions. AI systems can perform tasks that typically require human intelligence, such as learning, problem solving, decision making, perception, and language understanding. AI has a wide range of applications, including healthcare, which is on the first presentation, finance, transportation, and entertainment, and continue to evolve rapidly. And again, this also will not play. Is it not? Oh, all right. What are the AI features? AI has certain ingrained aspects. Today morning also they were telling, especially the honorable speaker, chief guest was making this reference. AI systems can learn from data, improving their performance over time through techniques like machine learning and deep learning. AI can use logical rules to draw conclusions and make decisions based on available information. AI can solve complex problems by analyzing data and identifying patterns. AI systems can recognize and interpret sensory information, such as images and sounds, through computer vision and natural language processing. AI can understand, interpret, and generate human language, enabling communication with humans in a natural way, which we see in many of the WhatsApp messages. Specialized systems designed to perform specific tasks is one type, such as voice assistance or recommendation algorithms, such as we play music, we ask for directions. This is what AI assists. What is a strong AI? Systems with broad cognitive abilities that can perform any intellectual task that a human can do. In higher education, what AI can do? It is a personalized learning can be improved. AI can tailor educational experiences to individual students' needs, enhancing engagement and outcomes. For example, AI-driven platforms can adapt learning paths based on student performance and preferences. In fact, as you browse in AI chats, it takes all the data and recognizes your own quest for data. And then it suggests the new forms of data. That is what exactly here, personalized performance. This personalized approach can improve academic performance and motivation and enhance research capabilities. AI tools can assist researchers by automating data analysis, identifying patterns, and generating hypotheses. This can accelerate the research process and lead to more accurate and insightful findings. For instance, AI can be used to analyze large data sets in fields like genomics, climate science, and social science. And professional development of educators, institutions should provide training and resources for educators to effectively integrate AI into their teaching practice. This includes understanding AI tools, developing AI literacy, and creating strategies for ethical use. For example, some universities offer workshops and training programs to help faculty members leverage AI in their classrooms. How for online performance, that I already told you. Actually, how many of us are enrolling into MOOCs online class? That is it. Learn anytime, anywhere concept. Similarly, SWAYAM, DTH, and using of ICT tools. I met a IIT professor who said, before going to his own class, he watches and learns from the online programs of this topic that he is going to teach. Then he is going to the classroom. But it is, I think it is free, only for examination purpose one has to pay. Because we are all having internet connectivity, but this is self-learning again. AI is also self-learning. But whether we are enrolling ourselves into these platforms is a moot question. And this morning also this question was asked, this ethical question. AI should be seen as a supplement to, not a replacement for human interaction and traditional teaching methods. So there is a fear. And this morning also the fear was raised whether AI can replace doctors. I don't think so. No, I don't think so. Now, I would like to tell you one case which we have been told time and again. You have the statue of father of medicine in General Hospital. where he was assisting the delivery of a child. At the delivery time, instead of head, the arm of the child came out. I was talking about way back, not now. So I'm 60 or 70 years old. That is a complicated situation. So they were scratching that. It is not in the books. So he asked anybody smokes. He asked a lighter to be brought. He lit the lighter and took the lighter near the child's arm. Immediately the child pulled the arm inside. After some time, the delivery took place. So this is a instance that is shown. Of course, you must have seen a film Yendra where the delivery is being also taken place. So where it is AI assisting delivery, what I told you is human intervention in the form, because what human brain can actually perform, after all, artificial intelligence is not artificial, if you ask me personally. It is being created by human brain, but it attains the form of natural brain and also superseding human brain, because human brain, we train ourselves not to use so much of data for analysis. But here AI can use these data for rapid analysis. That is the difference. But whether AI can write like Shakespeare or Milton or for Thiruvallur, I have my own questions. I have my own doubts. This creativity is only can come from human beings, not from the say artificial intelligence. Say we had a teacher. I studied only in Tamil Nadu, a small school in Shananagar, where we had a science teacher by name Karpagam. He never used to talk with anybody. But whenever he teaches, he draws the cross section of the eye, cross section of the heart. In those days, we don't have all the tools that you enjoy today. So these homeworks are done mostly by our moms and by sisters or somebody, the record notebooks. But here, this teacher used to tell the class, follow my hand. And he used to draw the cross section of the eye as well as cross section of the heart. I tell you, because we never had a mobile to capture what he was drawing. And even the most slow learner can also do the drawing. That technique, I don't think whether this is the difference between a teacher who makes the classroom a difference. So all the teachers are not the same. Teaching itself is very creative in nature. So giving information is the one thing, but making the class a joy and learning experience is yet another. So naturally, at no given point of time, I imagine that teachers can be physically removed from the classroom, and also you can supplement AI for that purpose. And maintaining a balance ensures students benefit from AI capabilities while still engaging in critical thinking and problem solving. This approach also helps in addressing concerns about over-reliance on technology. And institutional policies and guidelines, developing clear policies and guidelines for AI usage can help in managing its integration effectively. This includes setting standards for data privacy, ethical use, and academic integrity. Institutions should also consider the potential impact of AI on assessment methods and plagiarism. Actually, our entire research is bogged down by the last word, plagiarism, because we counter this with detection of plagiarism or software. We run our thesis and we have a separate mechanism, separate research wing to do this for all the theses. But there are methods also to bypass this mechanism also. They have found out. But yet, the most important thing is that if you are honest to yourself, and definitely the plagiarism can be easily avoided. And as I told you, technology is being used only for shortcut, but not for, I began my lecture only with that. Not for, this is the greatest problem facing academic administration. And who is doing copying? Say there is also in the lighter vein, if you copy from 100 books, you are producing a scholarly journal or scholarly article in a journal. Your work is scholarly if you are copying from 100 books. If you are copying from one book, it is plagiarism. So this is again a thing that you must remember. It is not copying, but acknowledging and also using the ideas. That is nothing wrong in research. And regulatory mechanism, UNESCO's recommendation on the ethics of artificial intelligence is a widely accepted AI governance. Governments impose similar policies in their regulations, such as US in their AI executive order, European Union in their AI Act. Additionally, 8 global tech companies, including Innet, Microsoft, Salesforce, have agreed to apply UNESCO's recommendation when designing and developing AI systems. Again, this is structure. So again, we have open education resources. AI can enhance open education resource by customizing content to meet individual needs, improving accessibility, and localizing resources for different contexts. Actually, this can really be inclusivity or inclusive sharing purposes, support of global educational equity and inclusivity. And continuous evaluation and improvement, regularly evaluating the effectiveness of AI tools and their impact on learning outcomes is essential. This involves collecting feedback from students and educators, analyzing data, and making necessary adjustments. Ongoing research and dialogue can help in refining AI applications and ensuring they meet educational goals. The positive aspects of AI, automation. AI can automate repetitive and routine tasks, freeing up human time for more creative and strategic activities. For example, AI-driven robots can handle manufacturing tasks with high precision and speed. Actually, one of the pictures or videos that I want to show was regarding this, but that cannot be opened. Optimization. AI algorithms can optimize processes in various industries, such as logistics, energy management, and supply chains, leading to cost savings and improved efficiency. And enhanced decision making. AI can process and analyze vast amounts of data quickly, providing insights and predictions that can inform better decision making. This is particularly useful in fields like finance, healthcare, and marketing. And predictive analytics. AI model can predict outcomes based on historical data, helping business and organizations to plan and strategize more effectively. Improved healthcare, this we have been seeing right from the morning, so I'll just skip this. Enhanced safety and security. Surveillance. AI-powered systems can monitor and analyze surveillance footage to detect suspicious activities and prevent crimes. AI can detect and respond to cyber threats in real time, protecting sensitive data and systems. And assistive technologies, AI can assist people with disabilities through voice recognition, text-to-speech, and other assistive technologies. AI can facilitate communications across language barriers to real-time translation service. AI can optimize the use of natural resources such as water and energy, leading to more sustainable practices for resource management. Climate modeling, AI can help predict and mitigate the effects of climate change by analyzing complex environmental data. Gray areas of AI. Today morning also we were talking about this. While AI can create new job opportunities, it may also displace jobs in sectors like, say, many areas. Tasks can be automated, leading to unemployment and economic inequality. This is a possibility. The shift towards AI-driven industries may require new skills that the current workforce may not possess, necessitating extensive retraining and education. In most of the software industries, many retrenchments are taking place, not because of excessive workforce, but because they are refused to learn. That is the reason why those people are, say, fired and then new set of people are included. And again, ethical and privacy concerns. AI systems rely on large amounts of data, raising concerns about data privacy and the potential misuse of personal information. AI algorithms can inherit biases because they are made by human beings from the data they are trained on, leading to unfair or discriminatory outcomes in areas like hiring, lending, and law enforcement. These are only examples. And again, security risks. While AI can really be positive on identifying security threats, it also can be a double-edged weapon. AI can be used to launch sophisticated cyber attacks, making it more challenging to defend against malicious activities. The development of autonomous weapons systems raises ethical concerns about the use of AI in warfare and the potential for unintended consequences, like drones, what we are using today. Over-reliance on AI system can lead to a lack of critical thinking and problem-solving dilemmas or skills in use. This is what real problem. Today, we are not able to count on a physical mode. We always rely. I don't remember my numbers. Numbers of my own family, or phone numbers. But earlier on, when I was using landline, I used to remember at least 10 to 15 numbers. Today, we are not remembering any of these numbers. We simply pick out our phone and go to the history and find out who has called. So this is only a mundane example, but in real time, critical example is that our brains will be refused to think critically and imaginatively. Dependence on AI systems can be problematic if they fail to malfunction, potentially causing significant disruption. It's very simple. I went to Apollo. Apollo is one of the medical stores where I want to buy certain only for 3 or 4 medicines. But it took them nearly half an hour to bill. They said the system is not working. Because this is a very simple example. The system is not. They could have given it in a handbill, but I was made to wait for half an hour. So this can happen in a larger scale. When we have social impact, the increased use of AI in communication and social interaction can lead to social isolation and reduce face-to-face interactions. AI can be used to generate and spread misinformation, such as deep fakes and fake news, which can have serious societal impact, which is already being done in other modes. Lack of regulation. The rapid development of AI outpaces regulatory frameworks, leading to potential misuse and lack of accountability. And establishing universal ethical guidelines for AI development is challenging, leading to inconsistencies and potential exploitation. Again, it stopped. I think that is the end of it. Okay, these are the AI tools perhaps you are conversant with and also using. DeepSeek. This morning, the Honorable Speaker was making a reference to it, R1. which has been made by Chinese. Again, ChatGPT. It is OpenAI. And Copilot is also being used. And Llama is Meta team. And Perplexity is Indian origin. And Kimi, this is the latest one. Actually, Kimi overshadows the DeepSeek. The moment Kimi is introduced, it has in fact disrupted many of the AI platforms. Queen, this is Alibaba group of companies, and Gemini, of course, you know Google. And in conclusion, I would like to say AI has the potential to bring about significant positive changes. That is true. It also poses substantial challenges. Balancing the benefits and risks requires careful consideration, ethical guidelines, and robust regulatory frameworks. As AI continues to evolve, it is crucial to address these issues proactively to ensure that its development aligns with human values and society. Thank you.
Thank you, sir, for giving us an overview of AI, especially in the field of education. Due to lack of time, I think we can take one question from the audience.
Sorry, I have taken much time.
Is there any question that you'd like to ask?
There is a body. I hope I will not say good question.
Good afternoon, sir.
Good
Sir, the moment ma'am told about your experience in teaching, I was thinking your experience in teaching is more than my age itself. So you have taught pretty many generations, right? So I wanted to ask this question. By introduction of AI, especially in education, in which area do you feel, sir, that people are affected completely? Like, for example, I feel like calculation skills has gone down, or my critical thinking skills have gone down. So with your experience, in which field or in which thinking area do you think that students are failing nowadays a lot?
Your good name?
Sir, Jessica Francis.
Jessica, the point of this seminar is how to overcome this.
Yes.
We should not succumb to this. So I have already indicated in my slides that there is a possibility of the danger that we've indicated. Okay. So the regulatory mechanisms that we are going to introduce in the education institutions, as well as a larger body like UGC or state education councils, state boards, and it is a wider question. In fact, if you ask the people, not everybody is conversant with this. Everybody is not using as you use, perhaps, or people using in Chennai, for that matter. Even if you take engineering students, whether all the engineering students, they know the list that I have given, whether they know about Kimi, I doubt very much. You understand? So one saving grace is we are still in our old structures. That is a saving grace. Ignorance is bliss in that respect. The moment you understand the potentiality of AI, then the problem starts. But given our own methods of assessment, our own methods of evaluation, I think AI's role is very, very less. Only it can supplement in certain areas. For example, what you said is critical thinking. And also the ability to be imaginative. And refrain from, say, putting your faculty to task. So what you do is the moment a topic you want to know, you go to open ChatGPT or Kimi, you ask for help. So you get sometimes they even don't edit. Without editing, that is brought and presented also. Understand? This danger is there, but our concern is how to, definitely it can affect all the areas, can affect many of the areas. When we are going to have a developed AI system into our educational tools, today we are facing the greatest danger in research is who is the writer. Say, my friend said one of the faculty professors went for a PhD viva. The candidate was looking at the title often. So his guide said, what are you looking at why are you looking at the title again and again? Sir, I'm not able to remember my title. So there is if you read between the lines, you'll understand that today we are facing the greatest danger is the shortcut methods of getting degrees as well as knowledge system. So we are trying our best to provide, say, regulatory mechanisms. Still, we are not able to overcome. But AI is such a powerful tool. You ask me very personally. It's a very powerful tool. The moment it takes the form that we have listed, like Blade Runner or artificially human beings being assisted, it can also lead to a lot of complications. Not only, in fact, AI, we feel that it thinks better than the human beings. When it comes naturally, there will be a separate division, like security division, thinking better than the AI or countering the AI. So you will have, say, orientations, you have warning signals, you have everything. Now you are getting in your phone, please do not answer any calls that you receive, fake calls. So like that it can also. Thank you.
Thank you, sir, for your insights on AI. We appreciate and we are thankful for the time and effort you have put in today for us. Thank you, sir. I now request Dr. Preeti, chairperson of this session, to felicitate Professor Rajendran, sir.
Yes. Yes.
I now invite Dr. Monica to introduce our speaker for the next session, Dr. Sabu Thomas.
Good afternoon, everyone. I take pleasure to introduce the speaker of the session, Father Sabu Thomas. He is a distinguished Catholic priest and educator who has made significant contributions to academic and social development. Currently serving as an assistant professor in the Department of English at Sacred Hearts College, Tevera, Kochi. Since 2013, he brings a wealth of educational experience and innovative teaching approaches to this role. His academic credentials include an MA in English Literature from Loyola College, Chennai, an MPhil from MCC and UGC NET qualification. He is currently pursuing his PhD at NGR University, Kottayam. His most notable achievements has been training over 60,000 teachers in AI integration through 265 workshops between 2023 to 25. carrying him to prestigious Teacher Empowerment Award from the Catholic Conference of Bishops of India in 2024. He has authored 10 books and continues to impact lives through his expertise in educational technology, teaching, training, motivational speaking, and life coaching. We are really happy to have you among us, sir, and the stage is yours.
Hello. 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 So good afternoon. Hello. Good afternoon, everybody. I'm a teacher basically, and I know that this is not a propitious time to do a theoretical session at 1 o'clock, even after closing 1 o'clock, and I know that you are all hungry, and I'm also hungry. And we've been sitting here for long, maybe from right from morning. So I think it's good that you all stand up, otherwise, you won't be able to sit for another 45 minutes. So can you all please stand up? Just stand up. All right. So let me assume that if you can look at the person who is sitting at the right side of you and the left side of you, can I say that you are sitting with the best friend of yours? When you came to the auditorium, you said, let us sit together, isn't it? So somebody sitting on your left and right is a person you know very well. But there is somebody who is sitting just behind you. I don't know how many of you have turned back and found the person who is don't now look back. Can you just who is the person who is sitting just behind you? Now the person is standing. And therefore, when I count from 3, 2, 1, 0, I have a task for you. When I say 0, then again I will count 0, 1, 2, 3. So in 3 seconds, you have to turn back and extend your right hand to the person and give a good handshake and say, good afternoon, with a smile. All right. And then within 3 seconds, you have to be seated. Ready? Ready? Okay. 3, 2, 1, 0. Sit down. What happened? So when she turned back to give a shake hand, she could find that the person sitting behind also is. I asked you to give a shake hand, but I could find many of you are, hey, look here, look here. All right. So, maybe in another few minutes, I think it's not intelligent enough, to talk something. I have some PPTs with you, and I think I should not show you all these PPTs, but rather my topic is artificial intelligence in arts and humanities, and therefore, considering the audience who are sitting in front of me, majority of you are students, maybe 90% of you are students, and I had a great opportunity to meet your teachers online. I think 4 or 5 months back. I have given a training for all your teachers sitting back in my room in Kochi, and your teachers in the evenings from 6 to 9, or to I think altogether 4 to 5 hours. I gave them a training on how to use online tools. How to use AI tools in the classroom. I hope all your teachers are AI empowered and they have started using AI tools in the classroom, and they are teaching having an AI blended method. Don't they? I have to keep it here, otherwise I might touch upon that, and then when I touch upon that, there is a connection disruption happening. You can talk for a while, because we've been sitting silent for long. Meanwhile, I am connecting this 1 minute is for to talk to each other very loudly.
One more announcement also to be made. At what time we can ask them to come?
Students, so we will break for lunch now and we'll meet at 1:45 p.m.
Participants, please listen. Those who are seated here, if you have not registered so far, kindly ensure that you register. And after your lunch, in front of this auditorium, there are people in the registration desk. You will have to sign again for the afternoon session and then come in. Kindly sign without fail because only then we can give the certificates for you. It will be easy for us to calculate. Lunch is at Riverlands.
YouTube stop பண்ணிருக்கீங்களா? YouTube வேண்டாமா? Stop பண்ண வேண்டாமா?
Don't worry, actually, that was the second case. Because, otherwise, at this point of time, we are all hungry. We can come back and we'll start.
Okay.
Don't worry. Take it.
Participants here online, kindly ensure that you are back here by 1:45 or maximum by 2 o'clock so that we can start the next session. Now we are all having our lunch break. Thank you.